A very good afternoon to everyone. My name is Sunitha Ravi Kumar, and I'm here to present in the fourth webinar series of the One Voice Symposium on Pediatric Concussion. The topic of the series is What are we doing to educate kids about concussion prevention, identification, and management? In the upcoming slides, I will be introducing you to Parachute's prevention and awareness programs in pediatric concussion. A little about myself. I am the Knowledge Translation Coordinator at the National Office of Parachute, located in Toronto. Parachute is a national charitable organization dedicated to preventing injuries and saving lives. Parachute's injury prevention solutions, knowledge mobilization, public policy, social awareness efforts are all designed to keep Canadians safe. Parachute was formed in July 2012 through the amalgamation of four organizations: Safe Communities Canada, Safe Kids Canada, Smart Risk, and Think First. As such, we bring together 80 years of combined injury prevention experience. Many of you may recognize these organizations, including Think First, that was founded by Dr. Charles Titile, who will be presenting later today. So what are we currently doing to address concussion in kids? At Parachute, we run a number of programs to address and educate kids about concussion. We integrate information about brain education, concussion awareness, and prevention into most of the work we do. For example, the Smart Hockey program, which was originally part of our legacy organization Think First, is designed to reduce brain and spinal cord injuries on the ice. Resources of this program include Smart Hockey Concussion Kit, Sports Concussion Assessment Tools, Pocket Concussion Toolkit, and the Smart Hockey video. The Smart Hockey Concussion Kit supports young hockey players with interactive injury prevention messages. As part of this program, the Smart Hockey video educates young hockey players and all those who support them on how to prevent, identify, and return to play after a concussion. Furthermore, the TD Think First for Kids is a curriculum-based program that introduces key injury prevention messages to children between kindergarten and grade 8. This fun and interactive program allows teachers to focus on specific injury risks and general prevention messages and engage their students in learning how to think first before participating in their favorite activities at play, home, and school. The next program, Brain Day, is a free and informative program for students in grade 4-6. Trained volunteers with an understanding and passion for injury prevention bring this hands-on program, which includes activity booklets, helmet fitting tips, and Jello brains to classrooms across Canada. As part of Brain Day, students learn about different parts of the brain, basic neuroscience vocabulary, and how and why it's important to protect their brain and spinal cord. By bringing this program into the classroom, teachers give their students a new awareness of injury and provide them with simple strategies to prevent it. We also have information dedicated to injury prevention practitioners. For example, Parachute's Horizon hosts the most credible resources on concussion, return to play, and return to learn. Solutions posted here are selected through an evidence-based framework informed by expert advisors. This process ensures that only the most credible information on leading practice solutions for injury prevention is made accessible to Canadians. Parachute also works across the country with other organizations, partners, and experts to ensure that organizations are sharing best practices, emerging research, and collaborating wherever possible through Horizon. Fortunately for Parachute, we have a number of successes to celebrate. However, in the interest of time, I will be sharing just a few today. The TD Think First for Kids program in 2014 alone was able to reach more than 30,000 participants of all ages across the country. Of these 30,000 participants, 13,000 were children alone. Now we're able to proudly say that 13,000 children are now able to think first about safety before play due to the efforts of this program. Moving along, Brain Day this year has also been a grand success. Since its inaugural session in 2004, Brain Day has now grown to cover over 25 Canadian communities, delivering brain and spinal cord injury prevention messages to over 36,000 elementary students. Furthermore, Safe Week was also able to garner a lot of strong success across the country. We were able to deliver over 200 kits to 120 communities across Canada and promoting cycling and road safety messaging. As with all things, barriers impede success. Since concussion is an invisible epidemic, we have to help parents, coaches, and teachers understand how to effectively identify, prevent, and manage concussion. Also, there is the challenge of changing the culture of silence and stigma around concussion, especially in sports, where young and vulnerable athletes may feel pressurized to ignore symptoms and keep on playing. From an implementation perspective, it is a fine balancing act to consider the kids' need for play and the caregiver's perspective for safety. Furthermore, one of the most obvious and ubiquitous barriers is that funding can restrict access, reach, and longevity of programs. However, our enthusiastic and reliable volunteers across the country have helped us cope with this barrier, and we are very grateful for their support. With respect to our curriculum-based programs at schools, there is a constant challenge that schools are often pressed for time, resources, and the impetus in using external curriculum-based programming above their own, and reasonably so. Finally, concurrent and competing messages also presents a challenge. As health promotion organizations, the onus is on us to present a unified and consistent message to our audience to ensure impact. As part of a call to action, I'm hoping to come away from the symposium with a larger understanding of concussion and research across the country and internationally to be able to better collaborate and share information about how to prevent and educate about concussion. I thank you for your time, and I wish you all a very good afternoon.